Hi everybody, thank you so much for joining us today. I'm Dr. Tahir from Family Pediatrics in Kenosha, Wisconsin, and today we have Katie starting with us and Jonathan, who's 1 year old. Jonathan had to use antibiotics. I had to give him antibiotics about a week ago for an infection that he had, and a little later on he started getting a rash. So mom called me and I talked to her about the rash, and we were able to send pictures that she showed me, and from that I could tell that he was having an allergic reaction. And today I want to talk to you a little bit about allergic reactions to medications, because they are unfortunately pretty common. Allergic reactions can happen with antibiotics or other medications also. Typically though, we see more reactions with antibiotics, and reactions happen usually if somebody's already used a course of antibiotics before and they're using it again at a different time. So the first time they use it, the body gets sensitive to that antibiotic, and next time they use it, they actually might have a breakout or a reaction. It's very common also for kids to be okay with the antibiotics for a certain number of days, and then maybe day number 5 or 6 or later on of the antibiotic, they may get a rash on their body. Now, when kids get reactions to antibiotics, there's two main types of reactions that kids can happen. One is kids can have a skin breakout, like Jonathan did, and that rash can be really itchy and red and sometimes a little bumpy. And the other type of reaction that can happen is breathing problems. So sometimes babies can actually have throat swelling and breathing difficulty. Now that is more of an emergency where you have to get medical attention right away. Come here, Pumpkin. That's a time when you have to actually get medical attention right away, either going to the emergency department or calling 911. Okay. When we talked on the phone, he didn't have any of those things going on. It was more of a skin rash. Okay. Mm-hmm. So I'm going to show you the skin rash now and some of the characteristics of the skin rash, and then we'll talk about treatment. Okay. So let's take a look. There you go. See if you can focus on that. There you go, Pumpkin. Good job. Can you see his skin pretty clearly? Mm-hmm. Okay. Now, when you take a look at the skin rash, it's a little red rash, and if you feel it, it feels a little bumpy, so it's a little bit raised. And the other main thing is if you press on it, it will blanch away for a little bit. You're kind of squeezing the blood underneath the skin a little bit, so it blanches, and then it turns back its color again. Did you notice that? So this is blanching, and that's a very common type of skin rash that babies get with an allergic reaction. Thank you, Pumpkin. He's trying to check my mouth. So also same thing, if you take a look at his legs look quite red. And if I take my thumb and I rub my finger on, you see how the skin blanches. That's very common of different allergic reactions. Kids can also have more of a breakout with reactions, and I have a good picture that I found to show you what urticaria or hives look like. He doesn't really have too many hives, but I'll show you a picture of that on the video. I'll put that in there. Okay, here's another picture of what hives looks like. Here you notice there's redness and also some whitish areas. These whitish areas are actually a little bit raised, so if you pass your fingers over, you'll feel the raised bumps. The hives can sometimes cover a small area or a much larger area, sometimes even big parts of the body. They can kind of come and go, so sometimes you might see them and next few minutes they might be totally gone. When kids have this skin rash, we can treat them with a couple things. Benadryl is available over the counter. Benadryl syrup is available in one strength. That's 12.5 milligram in 5 milliliters. So when you go to the store, look for Benadryl. If you're at Walgreens, for example, look for the Walgreens brand, okay? It'll cost you a little bit less, and it'll work the same way. Okay. Why don't you have a seat here for me? Sometimes, though, depending on how bad the rash is or if there's other things going on, then your doctor may be giving you a prescription for some steroid medication that will help the redness and everything there too, okay? Mm-hmm. Usually the rashes can go on for a little while even after we stop the antibiotics, because it takes a while for the antibiotics to run out of the system. What's most important, Katie, is that forever on, though, you remember that he's allergic to amoxicillin. So when you come to our office, we'll be asking you about allergies, even though we'll have it listed. And when you go to any pharmacy to pick up any medications, let him know that he's allergic to amoxicillin. That happens to be one of the most common antibiotics that everybody uses. So accidentally, it's still easy for him to get that medication. If somebody has a reaction to this antibiotic, if he gets the antibiotic again, the reaction may be worse. So it's going to be important to be careful with that. Sounds good?
Yep. Thank you.
You're so welcome.